Welcome back to Building West Michigan. I'm Anne Marie, your hostess, and sitting next to me is Mr. Joel Engel. And you are the Behavioral Health Services part of and Public Protection. We're actually at Behavioral Health Services and Public Protection. Now I got that right and I can say it. But you are Behavioral Health Services, and correct. Michael handles substance abuse. You handle a variety of other things, right?
Correct. I'm a social worker, and I do work with the behavioral health and mental health issues.
And you touched on a few things that you cover, but would you kind of just list to me some of the different things that people face that you deal with?
Well, you could put it in one word: is life.
Okay.
We live a life that is stressful, and stress creates a lot of different problems in different ways.
Okay.
And it's not really the stress that causes the problem, although that's what we identify. It's what causes the stress. Stress is just the message, but stress causes anxiety, depression. And then there's the communication issues, such as marital communication, behavioral issues with children. Then there's areas like like ADHD, both for children and adults, where there's a brain function that is influenced by medications. So it's being able to accurately diagnose and what's going on, and then provide both the counseling and then refer to a doctor if medications are needed.
That's the thing that I always wondered is, how do you tell if, because stress, life situations can cause a variety of symptoms. How do you tell if something is stress related, due to what's going on in a person's life, or if there are other problems, or if there's a combination? That seems like it would take a lot of dissecting to figure that out.
Yeah, it's more a question of how much or how little stress we have.
Okay.
Too much stress is bad.
Right.
Not enough stress is bad. If we have no stress, we don't get out of bed in the morning. If we don't have something to do, we don't do anything. Mm-hmm. And stress is just the message. Our emotions are just the message. They're telling us that there's something going on that we need to pay attention to. Mm-hmm. If we over-focus, then we get ourselves in difficulty. If we under-focus, we get ourselves in difficulty. If you're a student and there's a test tomorrow and you don't have any stress, you're not going to study for the test.
Okay.
But if you think about how you haven't done anything for the whole semester and you really get so stressed out that you panic, you're not going to study either. The stress needs to be the message that says, hey, there's a test tomorrow, I should do some studying.
Or if you're like me, you have a term paper due and you just know you do, and you got to do it, and oh my gosh, it's mounting, and you got to wait until 12 hours before it's due, and then you cram and you do it. Well, and then you look at it and you say, boy, I did pretty good, but I would have done a lot better if I'd done it earlier.
And right, and it's getting to that thinking that looks in the future that we're not very good at, and we wait till the last minute. And I tell people they're not lazy. They're just saving their energy for those things that are really important. Mm-hmm. And if we actually decide what's important, then we do better in dealing with life on an everyday basis.
You hear people talk a lot now about ADD, ADHD, and bipolar, and those are terms that you just hear so much of. And I wonder, and I just am curious, are they sometimes misdiagnosed, and are you able to find out if somebody truly is or truly has ADHD, or if there are other causes?
That's a really good question, and what you say is that there is probably too many people, children and adults, mm-hmm. on medications, both for bipolar and for ADHD. Mm-hmm. The question we want to ask, if I'm asking it for myself, am I better off on medication or not? If my child is having difficulties in school, paying attention and focusing, the question is he better off on medications or not? We want to be specific, and we want to look at the individual and what's going on in their life, how they're functioning, and then we have an answer for that person. The general answer doesn't apply to the individual. Just to use another example, 9 out of 10 people are right-handed. That doesn't tell me whether you're right-handed or left-handed. I have to ask you. So we need to ask those questions that indicate bipolar or ADHD. And then the interesting thing is about 80% of the symptoms for bipolar and ADHD are the same. So we have a lot of overlap in things. We're a whole person that is interacting in a lot of different ways, in a lot of different things, with a lot of different people. And we're constantly have emotions and feelings. And when we start getting ourselves in difficulties and going the wrong way, then they accumulate. So we want to get back to having a good day, knowing what makes a good day happen, and doing those things to get ourselves going and doing the things that we want to do and that we need to do.
That's excellent. I've got to remember that. What does it take to make a good day and make that happen? Because I'm the job that I do is very stressful, and so much of the time, you'll start out and things will be fine, and then 50 million things will happen almost simultaneously, and then you go, oh gee, I had this great day going, and now it's miserable.
Well, and when we get to that point, we want to take a step back and say, okay, what's the most important thing going on right now? What is the one thing that I really need to accomplish? This is my goal, this is my mission, and we do that. We get to the thing of beating ourselves up. We get to the end of the day and we say, there's that one thing that I didn't do. I'm a terrible person. Well, we forget to look at all the things that we did do.
I do that. I will write myself a list, and then I berate myself if I don't get my whole list done. And I forget to look at what in the list did I do.
Yeah, and in dealing with people, take the approach of, first of all, dealing with the whole person, and including their support group, who they're relating to, what's going on in their lives, but also giving them the tools to deal with not only the issue that brings them in today, but how to deal with that issue in the future and other issues. So it's giving people tools, ways to deal with things, different approaches, ideas, so that they can better handle what's happening in their lives on an ongoing basis, because something happens every day in our lives.
Excellent.
So
this is great, and like I said, we're going to be coming back and speaking with you, taking each of the different topics, or and maybe talking a little bit more in depth about them. And I'm already intrigued, because the big question is, does Ann have ADHD? In my mind, that's something I've always wondered, and that's why I asked you if there's a way to determine if you truly do have like ADHD. That's why I was curious about that, because I feel it personally.
Well, yeah, we have our ways to assess, but looking at it a little different. The question becomes, how much ADHD do we have? Because we're never totally focused. We're all distractible. If we describe ADHD as when there's 5 things going on, what we'd like to be able to do is focus on the most important. If we have ADHD, we're trying to focus on all 5 and don't do a good job of focusing on any of them. So, and even though we're focusing on one thing, and I'm focusing on talking to you right now, but I'm aware of other things going on too. I'm never totally focused on just one thing. But when it gets to the point, if I was talking to you and I was still looking out the window, and I was thinking about what I'm going to have for lunch, and I'm thinking about, oh, I didn't get that report done, my going off in other directions would interfere with talking with you, and that's where ADHD becomes a problem.
Okay. That's a good food for thought. It really is.
Yeah.
So if somebody is watching us and they're finding that they're having trouble either managing stress or wondering if maybe they do have some issues with attention deficit of any kind, like I think I do, or anything at all, if there's just life situations that are insurmountable and they need some extra help or advice, 733-9800, right?
Correct.
I'm going to remember that number. And Joel Engel. Now, do you do a phone consultation first, or do you have them just come on in? How does that work?
When somebody calls on the phone, we do enough talking to make sure that this is the right place to come to, that we have an idea of why you're coming in, and so it's a short information gathering, but primarily it's coming in and having a session and seeing where we can go, how we can address the concerns, and how we can make life better for you, helping you meet life's challenges.
Fantastic. Is there anything that I've left out that you'd like to convey at this point? Because we're going to be coming back and speaking with Joel again on several occasions.
Well, I think the thing is that when we're dealing with ourselves, we get stuck on our patterns. We get stuck in the everyday, and talking to someone else doesn't make us any different from anybody else. It's a way to give us some ideas to make our lives better and to make our lives better for the people who we're relating to and that are important to us.
Fantastic. Very well said. I would like to thank you, sir. And I'm looking forward to talking with you some more. And once again, if you're watching this and you need someone to talk to, give these guys a call. Michael Johnson, Joel Engel, Behavioral Health Services, and Public Protection. And they're located at, once again?
84 Seaway Drive, Muskegon, Michigan.
And phone number 231-733-9800. See you next time.